Bismillah ar-Rahman ar-Rahim. Welcome to my channel Science of Life with Dr. Mohammed Yusuf. Today I am going to talk about a very common ailment or disease of blood which is termed as anemia. But before that, one ayah from Holy Quran and its translation. This is an ayah from Surah Yusuf, ayah number 108. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم قل هذه سبيلي أدعو إلى الله على بصيرة أنا ومن اتبعني وسبحان الله وما أنا من المشركين قل هذه سبيلي हुजूर सल्लल्लाहु अलैहि वसल्लम हज़रत मोहम्मद सल्लल्लाहु अलैहि वसल्लम को फरमाया जा रहा है कि आप कह दीजिए कि ये है मेरा रास्ता अदउ इलल्लाह कि मैं अल्लाह की तरफ बुलाता हूँ अला बसीरतिन हिकमत के साथ बसीरत के साथ अना व मन तबानी मैं भी यही काम करता हूँ और जो मेरी इत्तबा करते हैं वो भी यही काम करेंगे व सुबहान अल्लाह और अल्लाह पाक है वमा अना मिनल मुशरिकीन और मैं मुशरिकों में से नहीं हूँ। ये आयत बता रही है कि अल्लाह की तरफ बुलाना नबी का काम है और फिर जो नबी के मानने वाले हैं उनका भी काम है अल्लाह की तरफ बुलाना बसीरत के साथ हिकमत के साथ तरीके के साथ अल्लाह की तरफ बुलाना ये हमारा काम है। अल्लाह पाक समझ अमल की तौफीक दे। So I am going to talk about anemia. Anemia, commonly it is said that it is the deficiency of blood. Yes, of course it is deficiency of, in some respect it is deficiency of blood. But there are many types of anemia. We are going to see classification of anemia. In a broadest sense, anemia is a functional inability of blood to supply the required amount of oxygen to all the tissues for its metabolism. Required amount of oxygen, if it is not being supplied, whatever the cause may be, it is anemia. When the requirement of the metabolism for oxygen is not being fulfilled. So anemia is actually itself is not a disease. Rather, it is expression of an underlying disorder or some underlying disease. It is expressed in the form of anemia. We are going to see in the classification of anemia. So it is the reduced supply of oxygen, less than required amount of oxygen supplied for the metabolism. The blood has very low oxygen carrying capacity. Oxygen is carried by the RBCs, the hemoglobin in the RBCs, and the total oxygen carrying capacity depends upon the number of RBCs, the quality of RBCs, and amount of hemoglobin in the RBCs, and the quality of hemoglobin in the RBCs. If something is wrong with any of these shape or the quality of RBCs or hemoglobin, the blood has abnormally low oxygen carrying capacity. Maybe the person is living in quite good oxygen atmosphere, but the blood is not capable of, lungs are all right, but blood is not capable of supplying the oxygen or taking the oxygen, sufficient amount of oxygen to all the tissues. So blood oxygen level cannot support the normal metabolism. Metabolism requires more oxygen, but blood cannot supply that much oxygen. And it is usually it is symptom, as I said. The anemia is usually a symptom of some other underlying cause. It may be in like that. So it is usually a symptom rather than a disease itself. The common signs and symptoms of this anemia, they include what the patient feels or what you can observe in patients. Includes fatigue or paleness. The color of the patient is pale, or when the person is walking or performing some activity, there is breathlessness or he feels a chills. Like that, we are going to see more details in some other signs in detail. We are going to see at the end of the lecture, inshallah ta'ala. The anemia, as I said, it may be due to the decreased number of RBCs, number one. It may be due to total number of RBCs may be less than required amount, or amount of hemoglobin in the RBCs may be deficient. RBCs number may be normal, but the total amount of hemoglobin, it is less than the normal. Or we can say collectively, we can say it is either the qualitative or quantitative deficiency of RBCs. Qualitative means number of RBCs are is less, and quantitative deficiency means the quality of RBCs. What is that quality? Hemoglobin. The contents of the hemoglobin in the RBCs are not required, not normal, they are deficient. So qualitative or quantitative or both. Maybe there are conditions in which the quality is also deficient and quantity is also deficient. So there is the qualitative or quantitative deficiency of RBC. That is a comprehensive definition of anemia. So decreased oxygen capacity. This will result into the decreased oxygen carrying capacity of the blood. Now the very I will classify the anemia in next lecture, inshallah. This is just basic knowledge about the anemia. The determinants of anemia, how the anemia will develop, what will happen to the RBCs or hemoglobin, or how the anemia, what will determine the this anemia, or which we term as determinants of anemia. It is one, either the RBCs are insufficient, decreased number of RBCs, yes, or RBCs number may be normal, it may be even more than normal, but the RBCs are themselves abnormal of erythrocytes. Number is deficient, or the RBCs are abnormal, or then there may be decreased amount of hemoglobin in the blood, decreased amount of hemoglobin in the individual RBCs, or the hemoglobin may be abnormal. So either the RBCs are deficient or they are abnormal, or hemoglobin is deficient or hemoglobin may be abnormal. We are going to see all these four determinants separately, inshallah. Now the insufficient RBCs, the first determinant, number of RBCs, if they are less, how they can be less? What can be the cause of this insufficient RBCs or decreased number of RBCs? Number one is hemorrhage. Bleeding is occurring, and lot of RBCs are being lost in the bleeding. Chronic bleeding or acute bleeding, that will result into the loss of the blood, and the hemorrhagic anemia, it results into the acute or chronic loss of blood. There are conditions in if some accident occurs and the person bleeds, they say the acute loss of RBCs and acute loss of blood, and there will be deficiency of RBCs, it will be acute. Or a person has got some disease, small amount of blood is being lost daily or for the long period, chronic. Maybe there are some intestinal worms which are sucking the blood, or there are some ulcers in the intestine or somewhere else which are bleeding slowly, and that will cause the chronic blood loss, but both will result into anemia. Both will result in the decreased number of RBCs. Then if the RBCs are normal, but if they are being destroyed by some abnormality, we are going to see what are the causes. We term them as hemolytic anemia. Lysis of RBCs, breakdown of RBCs is taking place. That is known as hemolytic anemia. That is the normal lifespan of RBCs is 120 days. That are about the 4 months. But if they are destroyed quickly within 1 month, 2 months, then the number of RBCs may be reduced. So prematurely ruptured erythrocytes we are going to see. For example, the hereditary spherocytosis, we are going to see that. Or sickle cell anemia. Then RBCs may not be produced properly. They are being lost, they are being broken down, or their production sites in the bone marrow, they are produced in the bone marrow. We discussed in the previous lecture probably the erythrogenesis. RBCs are produced in the bone marrow. If something is wrong with the bone marrow, what we term as the aplasia of the bone marrow, the site of the production, factory, something wrong with the RBC production. So destruction or inhibition of the bone marrow will result into anemia, which we term as the aplastic anemia. So In all these three conditions, there is decreased number of RBCs, decreased insufficient number of RBCs will be there, and the person will be suffering from decreased oxygen carrying capacity, or we can term as anemia. Then the second, this was about the insufficient number of RBCs. Now the abnormal RBCs, that is another determinant of anemia, that is abnormal erythrocytes. One is one disease, we will discuss this disease in detail as well, congenital spherocytosis. This is a disease, this is genetic disease in which the RBCs, instead of being normal biconcave shape, they are spherical, they are ball shaped, they are rounded, they are spheres, and that abnormality is known as congenital spherocytosis. The RBCs, instead of being biconcave discs, they become the spherical sphere or ball-like structure, and when this ball passes through the narrow areas in the circulation, they are destroyed easily. So this will result into the decrease in number of RBCs, more destruction of the RBCs as well. Number of RBCs will be decreased. So this is because of the abnormal shape of the RBCs or abnormality of the RBCs. The erythrocytes are not biconcave disc in this condition. They are spherical. They are spherocytes. They are known as spherocytes. Erythrocytes are spherical. And they are less deformable. RBC, very special, important quality of RBCs is they should be deformable. They can deform themselves when they are passing through the small capillaries, but these spherocytes in congenital spherocytosis, they are not deformable, they are rigid as compared to the normal RBCs, and these rigid RBCs, comparatively rigid RBCs, comparatively less deformable RBCs, they can easily rupture when they pass through the tight areas in the circulation, especially in spleen. RBCs are very easily destroyed. Then two determinants we have talked about. Then the third one, that is the decreased amount of hemoglobin. Decreased hemoglobin contents in the blood. For example, there is iron deficiency, one of them. Iron is required for the formation of hemoglobin. If there is deficiency of iron, proper heme formation will not occur, and of course the amount of hemoglobin will be reduced. Iron deficiency anemia. Iron deficiency anemia results from, it may be due to maybe a secondary result of hemorrhage. Hemorrhage is taking place. In the previous slide, I said the small bleeding occurring from the intestine or some other wound, constantly small bleeding, that is reducing the number of RBCs, and that is also causing the loss of iron. Iron is being lost in that blood. Bleeding may iron, there is loss of blood as well. So this is the secondary result of hemorrhagic anemia. If there is hemorrhage, it may result into iron deficiency. Then inadequate intake of iron containing food. We need iron. There are foods in which iron contains, for example meat, for example some vegetables, they do contain iron, some meat contain iron, some egg contain iron. There are foods which contain iron. So if the person is not taking the iron containing food, he may be suffering from the iron deficiency. Our iron intake is quite normal, but something is wrong with the intestine. The iron is not properly being absorbed. Then the person will be suffering from iron deficiency. So iron deficiency is one of the cause in which there is decreased hemoglobin contents. One of the cause is the decreased hemoglobin contents, decreased amount of hemoglobin in the RBCs, resulting into the low oxygen carrying capacity and decrease what we term as anemia. Then there is another decreased amount of hemoglobin. Thalassemia is a genetic disease. You must have heard this word. Thalassemia is not a very uncommon disease. It is not very uncommon. It is a disease, quite common rather. Thalassemia is there. It is a genetic disease. the person has got the genetic inability to produce some chain of the hemoglobin. We discussed the formation of hemoglobin. There are 4 chain, 2 alpha chain, 2 beta chain. If there is genetic deficiency of formation of any one of those alpha chains or beta chain, then the proper hemoglobin formation will not take place. So that condition is known as thalassemia. Deficiency or absence of any of the globin chain, alpha chain or beta chain. If they are deficient, this is genetic. And the alpha or beta chain. If the alpha chain is deficient, that is known as alpha thalassemia. If beta chain is deficient or absent, that is known as beta thalassemia. So this will also result decrease amount of hemoglobin. This is also decreased amount of hemoglobin, decreased hemoglobin contents in the RBCs. Then abnormal hemoglobin, fourth. So genetic, this is thalassemia, genetic abnormality I have talked about. Now then the abnormal hemoglobin content, whatever the level of hemoglobin may be, but the hemoglobin itself is abnormal. For example, thalassemia itself is a hemoglobin abnormality. So hemoglobin may be there, but it is abnormal. Absent or faulty globin chain, that is maybe abnormal hemoglobin. Another common disease, not very common, but not very uncommon as well. That is the sickle cell anemia. This is again genetic deficiency, in which we will discuss it in detail when we discuss the classify the anemia in next lecture, inshallah ta'ala. So the sickle cell anemia, in which there is abnormal faulty hemoglobin beta chain, in which only one amino acid is substituted for another amino acid. So that only change of one amino acid results into the faulty or the abnormal hemoglobin, which is known as hemoglobin S. This results from a defective hemoglobin, hemoglobin which is known as hemoglobin S. It precipitates very quickly when it is exposed to hypoxia, low oxygen tension. It is exposed. It causes crystallization of the RBCs, and RBCs are destroyed. So that will result into anemia. So abnormal hemoglobin, sickle cell anemia, common. So those 4 determinants we have talked about: deficient number of RBCs or abnormal number of RBCs, deficient amount of hemoglobin and abnormal hemoglobin. So those 4 determinants are there. So occasionally, sometimes there is an abnormal hemoglobin with increased oxygen affinity. This is another very important. Oxygen combines with the hemoglobin, it is a loose combination. From the blood, from the lungs, hemoglobin combined with the oxygen, and it carries, and it is easily released in the tissues. We will see how it is released there, but it is taken from the lungs and it is released in the tissues. The affinity between the oxygen molecule and the hemoglobin is such that it is easily released in the tissues where it is required. But sometimes this affinity, if the hemoglobin abnormality of hemoglobin results into the more strong bonds between the oxygen and the hemoglobin, this is what we term as abnormal hemoglobin with increased oxygen affinity, resulting in an anemia with normal or raised hemoglobin level, hematocrit or RBC count. All the values may be raised. Hemoglobin is okay, RBC is okay, hematocrit value is okay, but this hemoglobin is not releasing the oxygen because of the high affinity with oxygen. So this is another type of anemia where the RBC number may be normal, hematocrit may be normal, or hemoglobin content may be normal, or even more than normal. But the oxygen supply to the tissues is not taking place because of the more affinity of this hemoglobin with the oxygen. So anemia, now again we can sum up, that is, anemia may develop when the RBC's loss or destruction is more than the production. Yes, RBCs are normally being destroyed. Normally, after 120 days, every RBC is normal. RBCs is to be destroyed. But see, so there is a rate of production and rate of destruction as well. This is balanced in a normal person. But if the balance shifts toward the more destruction, less production, and that is so when RBC loss or destruction is more than the maximum capacity of the bone marrow to form the RBC, the person will be suffering from anemia. When the bone marrow production is impaired, for example, X-ray or some chemicals or some radiations or some maybe some drugs may cause the destruction, suppression of the bone marrow, etc. We will discuss it when we discuss aplastic anemia in next lecture, inshallah. So anemia may be associated with the nutritional deficiency, iron deficiency, vitamin deficiency, we will see it. Or external or internal blood loss, I talked about that. Or increased destruction of RBCs, hemolytic anemia, sickle cell anemia, we will see. And decreased production of RBCs, something wrong with the bone marrow. And the abnormal hemoglobin thalassemia or sickle cell anemia. And the bone marrow suppression by the toxins, chemicals, just I am talking about toxins, some chemicals, some radiation, etc. Or maybe infection, some cancer, etc. There may be destruction of the bone marrow, so the production will be less. So all these will be associated, anemia is associated with all these conditions. So bone marrow replacement by the malignant cells sometimes. That is, the cancer invades the bone marrow, and the normal bone marrow has been eliminated from the bone, and it had been replaced by the malignant cells, cancer cells. So in all these conditions, anemia may be there, or anemia may be associated with all these conditions. Now, the proper classification of anemia, I will discuss in next class, inshallah ta'ala. But another one type of classification I'm going to talk about, classification based on the shape and size of the RBCs, or hemoglobin contents, which we talked about today, hemoglobin contents and the shape of the RBCs morphology. So morphological classification of what we term as. Anemia may be classified morphologically, depending upon the shape and based on the average size of the cells and the hemoglobin contents. Size कैसा है और hemoglobin कैसा है, color कैसा है. So that is, if the size is bigger than normal, but something is wrong. There are anemias. There is a special anemia, megaloblastic anemia. The cells are bigger, but they are abnormal. So if the cells are bigger, that is known as, that bigger cell is known as, that anemia is known as macrocytic. Micro as compared to micro, it is macrocytic, bigger cells. And normochromic, normocytic, there are, the cells may be normal, but the hemoglobin contents may be normal, but still the person is suffering from anemia. Cause is decreased number of RBCs or abnormal hemoglobin, that is more affinity of the hemoglobin for the oxygen. So normochromic, color of the hemoglobin, contents of the hemoglobin may be normal, and the size of the hemoglobin may be normal, but the person is suffering from anemia, that is a normocytic, normochromic anemia. And then hypochromic, that is when the color of the hemoglobin, the cell is not normal, it is hypochromic, color is deficient. What is that color? That is hemoglobin is deficient. And microcytic, size is smaller. So hypochromic, microcytic anemia, depending upon the morphological classification. These are the normal cells. Normally, RB cells on the microscope, they are like this. That is, there is the color, you can see this color, and there is small lighter area in the center. This is the normal RBC. These are the normal. Now concentrate on the color and the size and the hollowness in the center. This is normal biconcave disc RBC. That is normal size, and volume means normal. Volume is also normal. It is looking like that. So it is the normocytic RBC. These are normal cells. This is again the another slide, that is normal actual slide. This is the actual picture taken from the slide. These are the normal RBCs. You can imagine these are the RBCs. These two are WBCs. We are not talking about these WBCs. These are the two WBCs. These are RBCs. These are nucleated cells. These are the white blood cells. So these are RBCs. You can see the size, shape, and that color of the hemoglobin. These are the normal RBCs. Now, if the cell size becomes smaller, it will be looking like microcytic anemia. The cell size is smaller. Size is not normal. This is known as microcytic anemia. That is smaller diameter and volume than normal, round or slightly oval red cells. Normal thickness MCV may be normal, but the cell size, this is almost normal size. These are the smaller cells. So microcytic anemia, if the cell size is normal. This slide is showing us a microcytic anemia. Normal size should be somewhat like this. This may be normal size. These are the, but most of the cells here, they are the microcytes, microcytic, and the color you can see. This hollow, this lighter area in the RBCs has increased. Normal, we saw that it is the light area is in the center, a small area in the center because of the biconcavity of the RBCs. That area is lighter. But in this anemia, the size is also smaller, and the light area is, that is, it is absence of hemoglobin. It is not visible. That red pigment is deficient. It is hypochromic. So it is microcytic as well as the hypochromic anemia. These are the WBCs. We are not talking about that. So macrocytic anemia, macrocytes, this is the actual, this is normal size. If the cell is bigger, these cells are known as macrocytes. This is the feature of vitamin B12 deficiency anemia. We will discuss it inshallah next lecture. When we classify the anemia, that is the megaloblastic anemia. This is a bigger size. You can see the lot of hemoglobin as well as the size is more. Hemoglobin is more. There is no light area in the center. This is the macrocytic RBCs, bigger cells, RBCs. So these are the normal cells, but there are many cells which are very bigger. This is megaloblastic anemia. Many cells there are bigger. These are the normal RBCs. And the normal RBCs, we can see normal cells, but the bigger cells are also there. So macrocytic anemia, that is the megaloblastic anemia, that is vitamin B12 deficiency anemia. Pernicious anemia as well. We will discuss it. So these are two WBCs. So normochromic RBCs we have seen. These are the normal cells. Now variation in color and size. Now collectively we can see. This is normal cells. Normochromic erythrocytes, color is normal. This is hypochromic. You can see the color has, the pigment is deficient. This lighter area has increased. This is hypochromic anemia. And the hyperchromic, when the color has increased, hemoglobin content has increased, there is no lighter area in the center like normal, it is hyperchromic. Chrome has increased, color has increased. Now on the size, this is normal size, both are normal. This is the normocytic, this is normochromic, normocytic, both normal. Normocytic, normochromic, and this is the microcytic. Microcytic size has reduced, and this is macrocytic. We have seen the slides in the previous. These are the microcytic. It is on one slide it is then. So depending upon the shape, size and the contents of the hemoglobin, we classify the anemia into microcytic, hypochromic, etc. We have talked about. But the actual classification, depending upon their causes, we are going to discuss in next lecture. Next lecture will be classification of anemia, inshallah ta'ala. Hope to see you in next lecture. Thank you very much.